Hello, everyone. My name is Eve Corbin. I'm just going to let a few more minutes so a few more participants can join. So I'll be right back with you in a minute. Thank you. Greetings, everyone. Bonjour à tous. My name is Eve Corbin, and I'm the chair of the webinar committees. And on behalf of CIPMM, I wish to thank you for attending today's session. So today's session is about Canadian Humanitarian logistics. We are lucky enough to have Mr. Olivier Trin, which is going to deliver this presentation. Olivier will walk us through real life case of some complex interventions that the Red Cross has done. So through real life, you'll be able to see the challenge of the logistics. So Olivier Trin is the manager of the logistics operations at the Red Cross. He has a bachelor degree in engineering from Compiègne University in France. And he also has a master's in logistics from Université de Montréal. So Olivier is our guest speaker today. I just want to remind you that the webinar series is every Wednesdays. There's something different every week, so feel free to check our website. And if you sign in for membership, you'll be able to access exclusive contents, which includes presentation like the presentation, the slideshow that you'll see today, as well as access to the recordings of the webinars and other contents as well. And finally, just wanted to mention quickly, we're going to have a virtual summit that will be held on 1st and 2nd of December. So we will have a 2 days event for learning for CIPMM members. Thank you very much. And Olivier, maintenant c'est à vous.
All right. Okay, can you see my screen, Eve?
Oh, good.
Okay, perfect. Okay, hello everybody. My name is Olivier, as I've just mentioned. I will talk to you guys today about humanitarian logistics. It's gonna be quite a long presentation, so hopefully I won't bore you guys. So first I'm gonna talk to you about the Red Cross in general. And then I'm going to go through some theory about the logistic rules and processes at the Red Cross. And then we'll attack what I believe would be the most important, most interesting piece of the presentation for you guys is actual cases of emergencies in Canada and abroad that the Canadian Red Cross has supported and how logistics support those operations. So we'll talk about Fort McMurray, Manitoba wildfires, development project in Haiti, the Canadian Red Cross Field Hospital, and of course, we'll touch about the COVID-19 operations that happened this year. And then we'll have a conclusion. So to start with, I'm going to go about what's the Red Cross. So you guys must have probably heard about the international movement of the Red Cross, or we hear about the Federation of the Red Cross, the Committee of the Red Cross. So what exactly is the Red Cross movement? So it's a humanitarian network that helps people facing disasters, conflicts, and health and social problems. So it's composed of different entities. One entity is what we call the ICRC. That's the International Committee of the Red Cross, and they are specialized in conflict situation. So for example, if you go to Syria right now, the main Red Cross component is going to be the ICRC because that's mostly a conflict situation. Then another component is the IFRC. So that's the International Federation of Red Cross and Red Crescent Societies. And that's an entity that mostly deals with natural disasters and health situations like a hurricane or Ebola in the RDC and stuff like that. And the other big component of the movement are all the national societies of Red Cross and Red Crescent. So the Canadian Red Cross is one of those national societies. So we compose all those national societies and we support the Federation or the ICRC when needed. So for example, let's say we talk about the earthquake in Haiti that happened in 2010. So the International Federation was leading the response, but then they would need support and staff and materials from the different national societies. And they would ask, oh, would that national society be able to support and send people or material, etc. And for the anecdote, actually, for that was one of the biggest humanitarian response in history in Haiti in 2010. And the head of operation of the Federation was a Canadian guy called Jean-Pierre Tachereau. So that's it for the International Red Cross movement. Now I'm going to talk about the Canadian Red Cross. And here you're going to see pop up a poll question, I believe, just to assess, to see if you guys know what the Red Cross does. So the question is, in which of those following activities is the Canadian Red Cross involved? So you can select a multiple choice. I'll give you some time to see what you guys know about the Canadian Red Cross. So I guess the time is almost up. All right, I think we can show the results now. Oh, I don't see them. Oh yeah, I do. Okay, perfect. So what did you guys choose? Small and large scale emergency and disasters responses in Canada, absolutely. Health equipment loan program is true as well. Swimming and first aid courses, yes. International programs, yes. And blood services was a trap. No, we do not deal with blood services. Okay, that's a common misconception of what the Canadian Red Cross does. So the Red Cross do that in other countries, but not in Canada. In Canada, we do not do blood services. It's another organization who does that. All right, so Canadian Red Cross was created in 1896. So we deal with emergencies and disasters in Canada, as all of you properly guessed, but we also have health services in Canada, and we do equipment loan program like medical equipment, stuff like that. We do have a prevention and safety department that gives first aid and swimming classes through training partners, and a lot of international programs. So I don't know if some of you guys are from Global Affairs Canada, but actually some people don't know that, but the Canadian Red Cross acts as a third-party logistics for Global Affairs Canada. So when GAC decides to support and send non-food items in a disaster area across the planet, they actually ask the Canadian Red Cross to do it, and we store those non-food items in our warehouses for the Canadian government. That's one example of what we do internationally, etc. So we are in this presentation today, we're going to mostly focus on emergency management. So what we call emergency management, to give you some idea and the general sense of what we're talking about. So for example, in fiscal year 2018-2019, you can see that we've responded on average of one disaster every 3 hours. So that's a lot, right? So assisted over 57,000 Canadians. So when we talk about disasters in Canada that we support, we're talking about anything that goes from a small house fire that affects a small family of 5 people. So let's say if today you guys are in Ottawa and hopefully not, but your house burns. What's going to happen? The firefighters are going to come, they're going to put out the fire, and the Red Cross volunteers are going to come and they're going to give you blankets, comfort kits, and they're going to put you in a hotel. And that's what we do all across the country. So we go from there to like large scale disasters, like wildfires that evacuate thousands of people. So everything from that to this kind of response, we are mostly involved. So that's what emergency management is in Canada. So some examples of like larger responses we've been involved in Canada, you can see here. I'm not going to read them all, but I'm sure some of them must sound familiar to you. Like recently, the Syrian refugees that arrived in 2016, the ice storm in New Brunswick, wildfires, a lot of them. We had the tornadoes here in the region in Ottawa and Gatineau not so long ago. And of course, this year, the COVID-19 operations that I will touch on at the end of this presentation. Some examples abroad. So we do work internationally as well. So we've been in the Philippines for Typhoon Haiyan. We've been in Nepal for earthquake, in Bangladesh very recently for the population movement that came from Myanmar. That picture on the left is actually from that response in Cox's Bazar. And just last year, we were in Mozambique and Bahamas for other emergencies. So that's what the Canadian Red Cross does in disaster time. Have there been any questions so far that about that first piece? Or no? All right, I'm going to keep moving then. So now I'm going to be boring you a little bit about some theory, but I think it's important for us to understand what's up. So logistics role during emergencies, we are a support function to operations, okay? We do not decide what we do, we decide how we do it. And as a support function, what we provide is procurement of goods and services, warehousing, and transportation. Those are the 3 main areas we support operations with. Our goal is to support 2,000 evacuees in 24 hours. 48 hours, we have 5,000 evacuees, and in 1 week, 25,000 evacuees. That means people in congregate shelter with cots, blankets, etc., everything. So how does our basic procurement work? This is very high level and basic, and hopefully it will very look like what you guys are doing in other part of procurement, no matter which department or ministry you guys are working in. So there's a requester that creates a requisition at the beginning. The supervisor has to approve the budget. Then a purchase agent turns the requisition into an order that is sent to the vendor. The vendor then delivers the goods or service. The requester receives the goods and service. The vendor sends the invoice, and our National Payment Center, that's what NPC stands for in that diagram, pays the invoice. All of that is done through our ERP, Enterprise Resource Planning System, and we use at the Canadian Red Cross Microsoft Dynamics AX. So this allows us to be able to all be using the same system all across the country, but also not just for supply chain management, right? Also finance, HR, etc. So everybody uses the same system. It's all talking to each other, which is a great improvement. And we've had that system for not so long ago, actually, maybe 3 years now. So I just talked to you about procurement, but of course in disasters, we can't always rely on buying stuff to be able to respond to a time of crisis, where we need some stuff to be in inventory before disaster happens. So that's what we call the standard relief items that we always have in stock in our warehouses. So we have cleanup kits, after the fire kit, hygiene kit, blanket, cots, and teddy bears. So cleanup kit is what you can see here in this picture is mostly to help people after a flood, to help them clean their houses. The after the fire kit, there's no picture of it right here, but it's the same idea, just after a fire, if you have any smoke damage, we have products to help you with that. An hygiene kit is a very basic thing here you see in the bottom left picture. It's just like toothbrush, toothpaste, comb, soap, shampoo, that kind of thing. Blanket, a cot that we use to open congregate shelters, and of course teddy bears that are actually very useful for kids and older kids to help them cope with like traumatic events. So how does our warehouse strategy work? It's quite simple. Actually, we have national warehouses, 2 of them, one in Calgary, one in the Toronto area. That national warehouse feeds into provincial warehouses all across the country. And those provincial warehouses feed in local stock. So we have local stock all across, like these Red Cross offices on some fire halls, etc. That's to help our responders deploy stock quickly, right? I mentioned to you at the beginning that we respond even to house fires. So in that case, we don't always have time to ship items from the provincial warehouse to go to the site of the fire. It would take too long for us to respond quickly. So that's why we have stock in the field directly prepositioned. In addition to that, as I just mentioned, so that stock can be used for small response. We call them level 1 or 2 responses. But we use provincial warehouse for larger responses because they usually would need more stock than what we would store in the local office. And of course, it can also come from the national warehouse, depending on the size of the event or the location. Now, this is also managed through our ERP, Dynamics AX. And the way it works is that we keep goods in inventory when it stays in the warehouses. And then when it leaves in the warehouse, we expense it, so we write it off. So that's how we charge the programs who are using our goods. Now, so that's what theoretically it would look like, but in reality, this is not really how it happens for larger response. We have to create a virtual warehouse in the system to send our goods for the response, and then to expense goods that actually that is actually being used. If I could ask you a question live, I would ask you, why do you think we do that? But I'm gonna have to answer my question myself. It's because in larger responses, operations tend to ask for more goods than they actually need. So let's say, for example, they say they need 10,000 blankets. Okay, and we ship 10,000 blankets out of the warehouse. And imagine now if we followed that pattern, we would expense 10,000 blankets, write them off of the inventory, and report to the donors that we spent 10,000 blankets. Now imagine a month later, the response is over, and they tell us, oh, they actually used 6,000, 4,000 blankets are coming back to inventory. So now we look like idiots because we told the donors that we expense 10,000. So to avoid that situation, we create a warehouse for the response where we can say we shipped 10,000 blankets. We don't know yet how many are being used. Then when we use 6,000, we can send back 4,000 in the inventory and report properly that 6,000 blankets were expensed to that response. So that's why we do it like that. All right, I promise I'm done with the theory. Now, how does logistics support in emergencies? So I'm going to talk to you very quickly about what type of disasters we support most of the time. So larger disasters in Canada are mostly due to floods and wildfires. And we're quite lucky because other countries, it's like wars and like drought and famine and stuff like that. For us, it's mostly just floods and wildfires. So the Canadian Red Cross mandate differs depending on the municipal, provincial, and federal agreements that we have. So most of the time, the Canadian Red Cross will likely provide registration services, lodging, feeding, personal services, supplies. But you guys have to think about it like it's a kind of a spectrum of services, right? We could go from taking care of the entire evacuation of people, then lodging, then feeding, then security, then providing supplies, then repatriation of people, or just one piece of this, or a little bit of it, or all of it. So it's a spectrum. It's not, we don't always do everything. It depends on the agreement we have. So yeah, so as I said, sometimes we even arrange transportation for evacuees to get out of the danger zone. And in addition to those regular larger disasters of floods and wildfires, we also support events such as arrival of refugees and asylum seekers. So for example, this picture on the right here was taken at the Montreal airport when Syrian refugees arrived in 2016. So now we're going to talk about actual examples. Fort McMurray fires in 2016. I don't know if you guys remember, it was in May, the fire started and there was an evacuation order 2 days later, and 80,000 evacuees in a little bit more than 24 hours. Okay, so that's huge. So in terms of logistics, what we had to do was shipping more than 45,000 blankets, cleanup kits, hygiene kits, teddy bears, and cots. So those are the items I told you we have to preposition in case of disasters, right? So that's why in those situations, you realize how important it is to have that stock on hand. So we had to mobilize that stock in all provinces across the country. There was not one warehouse in the country that had that stock, right? So we had to ship it all from across the country to Alberta. We had to open warehouses in Edmonton. We already had a warehouse in Calgary. We had to open additional warehouses in Edmonton. And then when Fort McMurray opened, we had to open another warehouse there to have the supplies as close as possible to the people who need it. We had to arrange deliveries of loaded cash cards. It's not something that we do anymore. We don't do any more loaded cash cards. It's a little bit too dangerous, but just for the story here, Brinks actually offered the transportation for free to the Canadian Red Cross. And I mentioned that because it's important to know that during disasters, private companies actually usually step up and want to help the community. Some of them, of course, is because it's good for them, right? It's their own employees that are impacted by the disaster, so it's better for them if we help the disaster get solved as fast as possible, but also sometimes just a genuine willingness to support and help the community where they work. So it's beautiful to see those kind of situations happen during disasters, of people coming together to help a common cause. So at that time, we also had to deal with transportation and lodging of all the staff and volunteers, all the responders that came in to help that response, right? So agreement with shuttle and taxi companies, local hotels, etc., and the University of Alberta for dorms. Because you have to understand that when we arrive in a location, we don't want to compete with hotel rooms from evacuees, right? Evacuees are coming to the same location to find a room, so we can't send responders and say, oh, we're taking that hotel for our responders. So that's why we need to find other solution like a dorm of university. This map here shows you where all the evacuees went out of Fort McMurray. So where did they go? And this was the first time we used maps and information management like that, but now in the Red Cross, Canadian Red Cross responses, it's very common that we use GIS mapping, etc. But this was, for us, it was revolutionary at the time. And we had data like this through a portal. So we knew where people were, and we had to bring evacuees home. So that was one of the tasks that we were asked to handle. So there was a green light from the authorities on June 1st for people to come back home. So that was 1 month after the evacuation. So we had to coordinate flights from across the entire country back to Edmonton and Calgary because the Fort McMurray airport was not open yet. And at the same time, so people flying back to Edmonton and Calgary, then coordinate with buses that had to go from Calgary, Edmonton, go to Fort Mac by road, and making sure they make it to the cutoff time in Fort Mac, where the municipality of Wood Buffalo was opening welcome centers, right? So they had people there to welcome people back, but so we had to coordinate all of that. It was a logistical exercise, very interesting, until the airport opened in Fort McMurray, and then everybody was happy, like that little girl here. So what was atypical about that response is what the scale of the response, right? 80,000 people were affected. It was the first time we used the registration portal online, and we did a mass electronic fund transfer for people. So usually back in the days when Red Cross was supporting evacuees, it was like physical support, like either giving out goods, but even cash cards or vouchers. And people would line up in front of Red Cross offices for hours to get that help. And so, but with the scale of that response, it wasn't possible, sustainable to do that. So that's the first time in the humanitarian history that an organization distributed that much money in electronic fund transfer. We had no agreements to start with the government of Alberta, so it was a tricky piece to handle. And the value of the donation we got reached $300 million. So that was a lot of money to handle and to do mass EFT with. But also it came with a high media coverage, high expectations, and high usage of social media. So that was the first time for us that, you know, Facebook was used to praise or trash us at the second something happened, right? So it was a new experience back in the days. So with all that money, we supported recovery programs, local community organizations, small businesses, and working alongside indigenous communities. Is there any questions so far, Ev, or can I move on?
No, here's one.
Okay.
So yes, so we had a question about Lebanon. So is Red Cross, has Red Cross or Red Crescent been involved, or will it be involved with the Lebanon explosion? So I'm not sure if you'd be in the know for that.
Yeah, absolutely. So if we can keep those questions at the end, if they're not directly related to what I just spoke about, that'd be great. But I can answer this one very quickly. Yes, we are involved in the Lebanon crisis. So as I said at the beginning, the Red Cross is an entire network. So there was a request to raise funds for us. So there is an appeal raised by the Canadian Red Cross, and we are currently in discussions to ship either non-food items or food, etc. So it's not confirmed yet, but we're working with the Canadian government and, of course, the Lebanese Red Cross to support that situation there. All right, so I'll keep moving on. All right, another case I wanted to talk to you about is the Manitoba wildfires. So a situation that was in 2018. Actually, I don't know if you guys know, but in Manitoba, there's a wildfire almost every summer. Like it happens all the time. It's not always the same community that gets evacuated, but it's almost for sure we know it's going to happen, just like the floods in Northern Ontario. So this time, it was a house fire in Northern Manitoba, May 2018. Canadian Red Cross is activated by Indigenous Services Canada, at the federal level. We have an agreement with them. And 5 communities are evacuated. So Saputawayak, Little Grand Rapids, Pawingasi, Kinonji-Oshtegon, and Marcel Colomb. So it's 2,600 evacuees. So every time there's an evacuation in Northern Manitoba, we always do the same thing. As the logistics support is the same, we coordinate all the air evacuations. There was 121 flights and ground transportation for evacuees. Then we had to manage the lodging. That was more than 40 hotels. And then locating and leasing suitable space for reception centers and providing essential supplies. So that's what we usually do all the time. What was particular this summer, there was an additional challenge. There was a sustained power outage that caused food to spoil and chemical to leak in refrigerators. So we were asked by ISC to replace all the fridges and freezers for all eligible households in 3 communities. And the tricky piece was all units needed to be in place before repatriation could begin. Okay, so that was our urgency. People couldn't come home before we handled that piece. So I just want to, before I move on, just want to insist on a point here. As you can see, we are already dealing with air evacuation, lodging, locating space, providing essential supplies, and there's an additional step here of taking care of those fridges and freezers. So what I want to insist on is preparedness, right? The preparation helps you deal with the regular stuff that we always do, so that it's easy and we know how to do that, and it's not a surprise. Even though it's an emergency and we didn't know it's going to happen, we know how to handle it so that we have time to focus on those additional challenges that no one saw coming. So I just want to insist the preparation helps you respond better. So the challenge with that situation with the fridge and freezers is that 2 of those 3 communities are only reachable by road during winter, okay? Because they are beyond lakes, and it's when the lakes are frozen that actually cars can go through to those communities. Otherwise, during spring and summer, like it was the case here, you can only access the community by air. So how do you do that? So we had to, Sapota-Wayak was okay, it's reachable by road, so we sent more than 400 units delivered by road on 8 trailers. But for the rest, for Little Grand Rapids and Pawingassi, we had to procure like all those fridge and freezers from like different suppliers, some out west. Like we had to. There's no. You cannot go into a Walmart right now and buy 700 units of fridges and freezers, right? We had to purchase that with direct suppliers of suppliers. And we delivered them to Winnipeg and then brought them to Little Grand Rapids and Pawingassi by plane to Little Grand Rapids. And then from Little Grand Rapids to Pawingassi, we had to use helicopters. So I just wanted to show you that because it was a special mandate and to show you what logistics does for responses. But yeah, it was a challenge, right? Because Pawingassi didn't have any airport there to receive a plane, so we had to find out-of-the-box solution. And that picture you see, it's actually fridges hanging out of a helicopter to be delivered to the last community. And so we used 4 helicopters flying back and forth for 3 days. And for the little story, we only lost 1. Actually, 1 fridge did fell off the net. And so there's 1 fridge sitting in the forest somewhere in northern Manitoba. All right. Just before I move on to that new case, is there any question about this piece? No. All right, perfect. Now I'm going to talk to you about a project in Haiti, in the city of Jacmel. So that project is not a response to the emergency, it's more of a development program, a project after the earthquake. So these are a few pictures to show you what the construction of that hospital looked like. So it was a project dealt with the Ministry of Health, Croix-Rouge Haïtienne, American Red Cross, and ourselves, among other partners. So the context, as you may remember, in 2010, there was a large earthquake in Haiti. And after the emergency phase, there was plans for rebuilding and long-term development. One of those projects in the Southeast Department was the reconstruction of the Hôpital Saint-Michel in Jacmel. So we had the green light of the Ministry of Health and the support from the Haitian Red Cross to rebuild the hospital with local experts and the Japanese International Cooperation Agency and funds from the American Red Cross. So how did that look like? It was a 2-story hospital that we were supposed to equip. So 50 beds, an outpatient ward, gynecology department, dental care, ophthalmology, even a kitchen and a laundry. So all of that, it was logistics role to equip all of those rooms and the entire facility. So how did we do that? At first, we had to validate the equipment list, right? So we had meetings with team from Hôpital Saint-Justine from Montreal, actually, and with local experts from the Jacmel Hospital in Haiti. And those 2 teams of experts decided what was best for the hospital, right? So it's tricky when you work in like poorer countries and you have like expectations of what you want to see in Canada. whereas what is realistic in Haiti, right? So those back and forth were needed to make sure we had a list that is appropriate for the field. Then the list was then approved by the Ministry of Health, and then we go through a regular procurement process that most of you guys know, hopefully, a request for quotation. So we're preparing documents with our legal department, release an international tender, and comparing bids with an evaluation team, selecting suppliers. So we selected a few suppliers, some international suppliers and some local suppliers in Haiti. And then we have to purchase the equipment. But that procurement is just one piece of the supply chain, right? So once all the equipment is bought, like what do you do with that? So we have to deal with storage, transportation, and customs. So as I told you, it was for a hospital that was being constructed at the same time, right? So we had to time our procurement timeline to make sure that it arrives when the construction's ready to receive the goods, right? So we used the expected timeline of when the hospital was supposed to be open, and then we went backwards in time and say, okay, this is when we need to place our orders, this is when we need to deliver, etc. Of course, like in every construction project, this was delayed for months. So we had our goods way in advance before the construction was done. So we had to store them in our warehouse in Mississauga, but also at the local suppliers' warehouses, right? As I said, we bought items from local suppliers in Haiti. So we had to ask them, can you hold them? Because the hospital is not ready to receive the goods yet. That gave us some time to actually identify every equipment for their future location. So what I mean by that, that I actually came to the warehouse with a bunch of volunteers and we worked on identifying every box of every item we had at the warehouse to say where it was going to go in the hospital. So it was color coded and we could say this is going to that floor, to that room, etc. And every box was made like this. And I worked with my Haitian colleagues in Haiti to do the same with the stock that was being held at the local suppliers' warehouses as well. Now, once it's done, we have to manage transportation to Port-au-Prince, from Canada to Port-au-Prince. And then there's a very long customs clearance process. So the Canadian Red Cross itself, we're not a legal entity in Haiti. So we have to go through the Croix-Rouge Haitienne, the Haitian Red Cross, that says, yes, we are importing those goods. Then they have to sign the documents to the Ministry of Health, that then send the documents to the Ministry of Economy that needs to approve and say, okay, those goods are for humanitarian aid. The custom fees are going to be lower or waived. And then the documents are sent to the customs authority. All of that, when I say it's going to the Ministry of Health and the Ministry of Economy, like in Haiti, it actually goes up to the minister to sign those documents, to stamp it. So that process takes weeks, if not months. So again, you need to be very well prepared and know your stuff before you start buying, purchasing, and shipping, because you don't want your goods to be held at customs and then pay extra fees for that. So the preparation, again, is very important for you to respond properly to those kind of projects, because you can't go ahead and then realize later down the road that, oh, there was an entire customs process that you didn't know about. It's too late to realize that. Anyway, once it's arrived in Port-au-Prince and once everything is cleared, then we arrange transportation to Jacmel. So that picture actually here at the top right is a picture I've taken in Port-au-Prince for the first truck that left the customs area in Port-au-Prince and the truck that was going to Jacmel. So it was a victory moment that we did all our homework properly so that our goods could be released from customs. And at the bottom right, you see the first supplies arriving at the Jacmel warehouse. Once it's delivered, you have to arrange the delivery at the actual hospital, right? So you have to coordinate with the construction site, because we don't wait for the hospital to be completely ready for then put the goods inside. Like it's in parallel. You don't want to waste time. So you have to coordinate also with the local suppliers for their own deliveries. We hired a team of handlers and a team for installing equipment, because we're talking about sometimes like more complex medical equipment. So this is what it looked like. When I say coordinating with the construction site, as you can see, we used the fact that there was still a crane on the construction site to ask them to carry our heavy equipment that was going to the second floor. So here you can see a flying dryer, and we did the same thing with the washing machine, so that we didn't have to carry them, right? So it's so that's what the logistics about, right? To work with what you have and coordinate and try to find efficiencies when you can. And eventually, we were able to equip the entire hospital before the grand opening. And this is what it looked like at the end. But to be honest with you, it's kind of a bittersweet project, because it went well, but the issues in Haiti are way deeper than just rebuilding or equipping a hospital. Like, we send team to train personnel, etc. But there's such a deeper problem of funding, etc. So I know that the hospital right now is not being used at 100% of its capacity, unfortunately. But it's being used, like, it's useful for the people out there, but it's not as much as it could be. And that's the reality of our work sometimes. Like, you can try your best to do the work, but when the issues are way deeper than what you can reach, you do what you can. But so it's not always those great stories that you see in movies. Oh, sorry, before I move on, any question about this piece, about the Jacmel Hospital? No. All right, moving on. So I'm going to now talk to you about the field hospital. So that's a different type of beast that the Canadian Red Cross has. The field hospital is what what we call, sorry, the health ERU, for emergency response unit. So if there's anybody among you, again, who works for Global Affairs Canada, you probably have heard of that if you are interacting with the Red Cross. So a field hospital is actually, like, it's very strange to see. Like, it's a hospital that sits in a warehouse, or it's all packed in boxes, etc. And then it gets deployed to the field, and it opens in tents, etc. And then it's an actual hospital that is running. So we can have surgery, mass casualty triage, inpatient care, community health outreach, X-ray capacity, etc. So after a few years of deploying and feedback from delegates, doctors, nurses, etc., like, we understood that we had to make it modular, right? So it's a modular configuration now, so that specific services can be deployed depending on healthcare needs in the most efficient manner possible. So let's say, for example, we are requested to send a field hospital for a cholera outbreak. We're not going to send the entire hospital, like, we're not going to send the surgery unit. We're just going to send what is needed for the cholera outbreak. Whereas before, back in the days when that concept started at the International Federation of the Red Cross, it was all or nothing. We would always send the entire artillery for any kind of response, which was not an efficient way of deploying goods. So now it's modular. The principle of the field hospital is that it needs to be ready for takeoff in 48 hours after we're activated. It can treat 200 outpatients per day. It has a capacity to up to 100 beds if needed. It's designed to be self-sufficient in remote and low-resource environments for a minimum of 1 month. It's usually deployed up to 4 months. And it's accompanied by experts, of course. So we send nurses, doctors, technician, logistics delegate, etc. So how are we preparing for that? Again, preparation is key in that piece. So we have a warehouse close to Toronto, and we purchase items in bulk through established framework agreements. And we do the kitting at the warehouse regularly to create those modules that I've talked about. Okay, and if after a response, delegates, doctors, nurses tell us, oh, like, that kit should be arranged differently, it should be better if it's like that, etc., then we can modify after the deployment and always improve our field hospital. The expiry date are managed through the ERP I mentioned to you earlier, again, Dynamics AX. And we have regular maintenance schedule for generators, vehicles, etc. Once it's deployed to the field, procurement is done through a mix of local, regional, and international procurement. So depending on what's needed, we can do all of that. There are also pharmaceuticals involved, right? It's a hospital. So we have an interagency emergency health kit. And also, interestingly, we have a framework agreement with a pharmaceutical company in Europe that pre-kit and with a pre-kit and predetermined list of pharmaceuticals that we need for those field hospitals. So the Canadian Red Cross is not the only national society of Red Cross, Red Crescent that has a field hospital. So we have that agreement with that supplier, a pharmaceutical supplier, for every other national societies that have a field hospital. So the Norwegian, the Danish, Spanish have field hospital, they can use the same agreement. And that allows us to let someone else manage the expiry dates of pharmaceuticals, and they are already ready with certificate of origin and certificate of analysis at time of deployment. Because as you may know, those documents are needed when you send pharmaceuticals to another country, right? When you pass through the customs, even though most of the time customs are going to be easier in time of disasters, you still need to prove that what you're bringing is up to standards. Interestingly enough, some of the pharmaceuticals we use for narcotics are allowed in all the countries in the world except in Canada. So if we need to deploy in Canada, we actually need to find another supplier for that, for some pharmaceuticals. Is there any questions about the field hospital?
Yes.
That's all right.
Yes, so we have Danielle Hillsworth that is asking, what does COO and COA means?
Oh, I just said it. So it's certificate of origin and certificate of analysis. But yeah, so those are documents that accompany pharmaceuticals when you have to ship them abroad.
And there's another one. So do you want me to put it at the end, or we can do it?
No, go ahead. Go ahead. I think we have some time.
Okay. So you deploy supply mostly goods. You do not procure human resources like professional services, or do you?
So we do. I did not address it a lot here because in logistics we only deal with goods, but there are what we call delegates that are trained by the Canadian Red Cross and other Red Cross and Red Crescent societies that are sent with that hospital, right? So it's when we send that hospital to the field, as I said, it must be self-sustainable. So we send the human resources and the goods to make sure that we are supporting the system where we're going and not being an extra burden and taking local staff around that are needed elsewhere. So no, we definitely send people with that. So doctors, nurses, technician, logistics delegates, etc. Even admin people like to manage the entire little hospital, like it has some administrative components and to interact with other authorities around. So either like the municipality where we are at, or even other humanitarian organizations that would deploy in the same area to make sure that we are not duplicating efforts. Like if MSF, Médecins Sans Frontières, who are another great humanitarian organizations, are in the same area, we would make sure that we're not doing the same thing and we are covering as much need as possible. So yeah, no, we do send people, but it has nothing to do with logistics though. But it's the part of HR who does that. But yeah, it's part of the hospital that we send. They are actually usually sent even before the hospital. And we try to have an advanced team and make the assessment, etc. All right, moving on to our last case before we run out of time. Oh, some pictures, sorry. So at the top left, you see the hospital that was deployed in Nepal after the earthquake. And at the bottom right, that's in the Philippines, I believe. Actually, I'm sure it's the Philippines after a hurricane. That's the Canadian Red Cross deploying that, most of the time funded by the Canadian government. Okay, now I'm going to talk about COVID-19. So since the beginning of the crisis, even before the crisis happened in Canada, we were already working on a few operations related to COVID-19. One of the first one was actually a request from the government of Canada to supply PPEs to China. That was before, of course, the crisis reached Canada. Then I don't know if you guys remember, there was that story in the news that Canadians from Wuhan had to come back, and then we had all those cruise ship situation of Canadians stuck in cruise ships where the outbreaks were way higher than elsewhere. That needed to come back as well. So those people were repatriated in Trenton, Ontario, and Cornwall, Ontario, and the Red Cross actually deployed there to support those operations. And we actually deployed the Healthier You mini clinic, a small version of it, but a small version was deployed in Trent. We also did a lot of provision of relief supplies to municipalities and communities that were bracing like for the crisis to hit, right? They were making sure they could open like separate shelters, or if there's an outbreak in their city and they want to separate them from other patients, etc. So we did provide a lot of cots, blankets, etc. For the past few months. We also provided epidemic prevention and control services in long-term care homes in Quebec and Ontario. And additionally, I don't know if there's some PHAC people on the call, but there are PHAC opened isolation sites close to the airport that were still open to international flights. For everybody coming back to Canada, if they couldn't isolate themselves in less than 12 hours, they were put in a hotel close to the airport in isolation until they get the result of their test or until they go through their quarantine time. And the Red Cross is supporting, and is still right now as we speak, is still supporting in those locations in Vancouver, Calgary, Toronto, Montreal, and other cities in Atlantic, and in Regina as well, I believe. So right now, for example, in Toronto, we have more than 100 people. I think it's almost 150 people in hotel that we are supporting for that. And recently, the military left the long-term care homes in Quebec, and the Red Cross filled the gap until more staff are trained by the province. And this is happening as we speak right now. That's actually the biggest project I'm working on. So what is the impact on supply chain and logistics? Of course, as you guys must know, we had the challenge of procuring PPEs, right? So we had to place rush orders at the beginning, but also to try and respect our procurement policies, we had to do an RFQ in parallel and make sure that we are following proper procedures for longer term needs, because it wasn't just a need that we had in March. Like even today, we're still using PPEs, right? It looks like it's going to be true in the next few months as well. So fortunately for us, we were able to put up a Red Cross and a health and safety committee. So as I mentioned to you, we have a field hospital. So that means we already have medical expert in-house. In addition to that, I don't know if you remember at the very beginning of the presentation, I said the Red Cross is involved in disasters, but also in health equipment programs. So we already have all those experts in-house, so we were able to get a committee, and those experts were able to identify standards and specification in deciding when and how PPE are given out, right? Because at the beginning, it could have been a real mess. Like, and everybody would say, oh, I need a mask, I need a face shield, goggles, gloves, and a gown because I want to get to the office and type a report, right? So thanks to that team of experts, they were able to classify all our jobs, all the stats that the Red Cross do, and say, if you're doing this, you're in that category. And if you're in that category, you need 4-piece PPEs or 2-piece PPE, or you should work from home, or those kind of things. And this really helped us to update our operation procedures and to make sure everybody was on the same page all across the country, and there was no team that was hoarding PPEs for nothing and no valid reasons when others actually needed them. And then of course, we had multiple working groups consulted, our legal department, scientific team, finance, obviously, etc. So one of the other impact on supply chain and logistics in that response was the we had to find innovative ways to deliver goods to beneficiaries, right? So back in the days, normally we would arrive, open like a desk, it would be in a shelter or in a hotel, doesn't matter. We would give out items directly to people who for what they needed. But now with all the COVID and like the social distanciation that is needed, we couldn't do that anymore. So we had to come up with an entire different process. So right now, for example, the people at the PHAC site that I mentioned earlier, or even the people that were in Trenton, we had to set up a process where they would call a virtual team on the phone of the Red Cross. That team would gather all the information of what is needed from every site, every hotel, every room. So let's say John Smith needs that, he's in hotel that in Trenton in room 102. And then once a day, they would extract all those information that was gathered and send it to the proper logistics team on site. And then the logistics team would be able to purchase the goods locally and bring it to the site. And then at the site, we had people with proper gear, with proper PPE that would pick up the goods and then deliver them to the rooms. So with a 24-hour turnaround like that, that's how we handle those kind of requests during that crisis. And of course, all those PPEs take space. We're talking about millions of pieces of PPE, so we had to find additional storage space. Thankfully, we have that ERP that I mentioned several times now, that Dynamics AX. That really helped us, because probably some of you guys ran into those issues as well, but of some quality problems. So let's say some people started saying, oh, that mask, actually the loop is breaking very easily. And then you start hearing it several times from different people. We could track which batch number were those masks from, and we could remove them and replace them with a better batch thanks to that ERP system. Otherwise, we would have had no clue. We would have just said, we sent you mask. We have no idea which mask it was. That's it on the COVID-19. Is there any questions about this? Yes, all right.
Yes, so it's a question from your former colleague Hamza that I stole for my
okay.
department.
I'm not going to answer that then.
So the question is on domestic operation. How has transition between being from military at long-term care homes to Red Cross from the virus response in Montreal? Yeah. Yes.
Mm-hmm. Well, it was tricky, to be honest, but that's more of an operational question. But in terms of logistics, it was fine. Like we procured all the PPEs that were needed, and some of them were used directly in the long-term care homes. But the transition itself was tricky. It's still going on right now, but it was because the military role was not exactly the same roles that the Red Cross would cover, right? So the expectations sometimes were not aligned. But I think the Red Cross did a pretty good job, because they are in larger numbers, let's say, than the military on site. Then the tricky piece is mostly communication issues, right? From what the Red Cross says to the federal government, and then to provincial government, and what is understood at the long-term care level of what is going to be provided. That's always where the tricky human piece of what I expect and what I see is not always aligned. I hope that answered your question, Hamza. You traitor. All right. Is there any other questions or? No? Oh, okay. I'll move on to the conclusion then.
One, it was posted in the chat. So are you considering using drones for deliveries?
No, not now. Like we've had some talks about that. We wouldn't. I don't think the Red Cross would go there until it's actually being used and we see that it works. It's been in the talks. Like, of course, we have a team that looks into all those innovative things. Not now. I think in some international contexts where like roads are completely closed, etc., we would be very open to the idea, but we haven't seen anything that is actually sustainable in working. But if it does, yes, of course. But right now, I can tell you that it's not being used by the Canadian Red Cross. Maybe other organizations do, but I haven't seen it personally.
There's another question, but perhaps we'll address that after your conclusion.
All right, sounds good. So here's a poll question actually for you guys to see if you followed properly. So what should you count on when working in an emergency response? Should you count on luck, preparedness, winging it, or hoping that someone else will do it? And, okay, let's see the answers. There's always one comic person who said someone else would do it. But yes, you guys mostly listened properly to the presentation. Yes, preparedness is the key. So I'm gonna reach my conclusion here. If my computer accepts. All right, perfect. So conclusion. Some trends that we've noticed in the past few years is that we are more and more reliant on technology. So we use a centralized platform for beneficiaries registration, assessment, etc. So what that means for us is that there's way more need for IT equipment, right? For laptops, tablets, cell phones, etc. It's a whole other ball game to handle. Like it's not like a blanket, because it involves the IT department for maintenance, etc. So it's a challenge sometimes. And also, we use more and more, as I mentioned earlier, electronic fund transfers and prepaid loadable cash cards. We try to, to give the opportunity to the beneficiaries to actually choose themselves what they need as much as possible, instead of buying the stuff ourselves and then distribute them, which is better for, it suits their needs better, right? It's better also for dignity, as you can imagine, when you can actually go and buy your own stuff without, whereas being handed something over. But then it depends on situations, right? There's situations where everything is destroyed or there's no other options, and we'd rather give something than nothing. But this is a trend that you kind of see in every actually humanitarian organizations, of trying to empower the beneficiaries as much as possible, when it's suitable, of course. Now, as you guys all answered properly earlier, preparedness is key, right? So even in emergencies, most requests can be anticipated, right? So agreements must be in place in advance, and preparedness gives you time to pivot quickly and stay flexible and agile when unexpected events happen. So of course, there's always that. You'll always hear people say, "Oh, it's an emergency. You can't predict anything," but it's not true. That's an excuse for incompetence. It's when there's an emergency, you know that people are going to be evacuated. You know what evacuees need. Like they always need a shelter. They always need food. All those things can be prepared. There are, of course, always situations you cannot predict, but being prepared for all of those predictable things, even though you don't know when it's going to happen or how many people are going to be affected, being as much prepared as possible helps you respond properly to the actual unexpected events. All right, so if there's one thing you have to take away from that presentation, is if you fail to plan, you plan to fail. Now, I want to end with talking a little bit about that picture on the right, which I believe was taken during the BC fires 2017, I think in 100 Mile House. So what you see in that picture is, I really like it, and I show it to when I have new employees coming in my team. I try to show them that, because you see the cleanup kits I mentioned to you earlier, the presentation. You see the comfort kits here, hygiene kits, sorry, and the after the fire kit. So in logistics supply chain, we spend a lot of time like working with Excel spreadsheet, with ERP system, Dynamics AX, phone calls, emails. But at the end of the day, we have to keep in mind that why we're doing that, right? And it's to make sure that those people get the goods. So our work our work is to make sure that the right stuff arrives at the right hands at the right time. And the work that we do does that. And when you see that picture, you see, oh, this is what I've been working on, right? When I bought all those goods, when I stored those goods, when I manage the transportation of those goods, is to make sure that people in need actually get them. So thank you all. That's the end of my presentation. And now I'll take a few questions before we need to go. But I think I kind of overstepped already.
Yes, thank you very much, Olivier. Comments are wonderful about your presentation in the chat room. People will be able to see the presentation and download the deck in the CIPMM website. There was another question that's not yet been answered that was posted in the Q&A section, and it's about the vaccines. So for COVID, will you follow the same logistic procedure as PP for upcoming, hopefully, distribution of vaccines when they're available?
I don't know if the Red Cross would be involved in the vaccine situation there, or if it's all going to be handled by health authorities at the federal and provincial level. I'm sorry, I cannot really answer that question, but we are trying to get ready with more. I mentioned the field hospital earlier that is modular. So we try to have those smaller versions of that hospital that would be able to help vaccination campaigns if needed. But I don't think we would manage the stock of vaccine unless that is unlikely from what I think. Any other questions?
No other questions, Olivier, but
all right.
I really want to thank you very much for your generous time, for putting together such a detailed presentation with actual case so people can see what's behind the scene, what's happening in the action. People have really appreciated that, to see what's happening for Red Cross operations. So I thank you very, very much for that. And for our CIPMM people that did attend, I want to thank you for attending to the webinar Wednesdays. As mentioned at the beginning, it's every Wednesdays. Next week, we will have the business acumen en français. So for the ones that want to progress as in the procurement group in the federal sector, that will be next week's presentation. Registrations are open. And then after, everyone knows that NAFTA has been replaced. So the following one will be NAFTA is done, so what? Now what? So it's going to be by a lawyer that was formerly with the Department of Justice. Just want to say thank you for attending. Webinar Wednesday is always free. All the contents are available in the section for members only, but membership is free. So don't worry, just create your profile and you'll access everything. And just a little reminder for the virtual summit in December 1st and 2nd, and it's going to be 2 days full of professional development. So we're looking forward to seeing you. Thank you, everyone. Thank you very much. And thank you again, Olivier, for the great presentation. That was really instructive, and people have really appreciated that. Thank you so much.
You're welcome. Bye-bye.